All right, well, good. Well, Elizabeth, we're moms,
We are.
and I think most moms would agree there are a lot of changes our bodies go through after we have those babies. And sometimes there are changes we don't want to talk about and think we just have to live with.
Guess what? We're going to talk about them today. Our straight talking OBGYN says it's time to think again. Here were some treatment options, whether you're in your 30s, 40s, 50s, beyond. From Wyzetta Cosmetic Surgery and Spa, we want to welcome Dr. Lisa back to Twin Cities
Hi.
Live. It is so nice to see
Hi.
you.
Yes, thank
all right,
you.
we sit down and we hash it all through so you don't have to feel embarrassed when you go to your doctor and talk about it. When you're in your 30s, what are some of the issues that women are concerned about as we are, thinking about we're getting a little older, maybe we've had a baby or two, what's going on?
Typically in your 30s, we're talking about after having a baby. And that's near and dear to my heart because as an OBGYN, I had delivered babies for the first 20 years of my life, but recognized that there was kind of a need for women beyond childbirth, which was relatively neglected. And so I created a practice that integrates health, beauty, and intimacy, realizing those are very connected for women. So these shameful issues that nobody talks about is exactly what I opened my practice for. So commonly things like looseness, appearance, incontinence, leaking urine. Listen, if you're a man and you have, if you were delivering a baby through your man parts, and things were not quite the same, they were stretched out, they didn't look the same, they didn't perform the same, and you were dribbling urine all over yourself.
Yeah, that would be
And
solved.
you're expected to just live like that.
Exactly.
Yeah.
And that somehow you would be ashamed to talk about that.
Right.
That's terrible. And when I realized that, I was like, you know what? It's time to do something about it and find some treatment options. So the wonderful thing is we are now living in an age where there are just tremendous and innovative treatments that are getting attention worldwide, and I'm excited to be a part of that.
Tell us about this Thermiva. So what does this do for women who are dealing with that very issue?
Yeah, so Thermiva is a new treatment that has been around for a couple of years. It uses a gentle form of heat called radio frequency energy to basically heat the tissues, and this creates collagen, which ultimately will lead to firming, tightening. It has a significant effect on the bladder as well. So there's improvement in things like incontinence, leakage, urgency, frequency. Those things are commonly nearly corrected, if not completely corrected.
Okay, mamas who are home with their babies are hearing that
That's
and they're like,
amazing.
this is incredible.
And it's not, it's small. It's about the size of your fingertip. The width of it is, but it doesn't look abrasive. It's not a scary device.
Yeah.
So it really is, you shouldn't be afraid of something like this.
It's amazing, actually. So it is about the size of your finger, and it's just gently placed inside your feminine canal to heat the tissues, as well as externally. You can actually get really nice and quite amazing tightening with it all the way around. So again, as much as we are often embarrassed to talk about the issues of intimacy, this is the foundation of our relationship. Without it, our relationship becomes a platonic, basically roommate situation.
Right.
Exactly.
So there can be some more severe concerns where surgical vaginal rejuvenation is utilized as well. So how do you know if maybe, okay, we might need to go a step further when it comes to tackling this?
It's typically something that often a woman knows where there's so much tearing, there is so much damage that is done that really no amount of just tightening is going to make the difference, that you actually have to surgically bring the tissues back together.
And that is a possibility, though.
It is a
It's
possibility.
not something, again, to live with. It's something to talk about and try to get figured out.
Yes.
So that was our 30s after the babies. Then we move on to our 40s, and increased laxity, we could experience that. And Thermiva can help with this as well?
Yes. So Thermiva can help, both 30s and 40s. Really, 40s is just all about the process of aging.
Yeah.
That now you've not just had one baby, you've had maybe multiple babies, or that just age, Mother Nature, she just wins every time, gravity and loss of collagen. Well, guess what? If you see skin laxity here, below the waist, you're going to have some laxity there too. So you may not even have had a baby. In other words, you may not have had children at all, and yet there can be laxity issues, incontinence issues, that both the Thermiva as well as something called Mona Lisa Touch can really make a difference.
Okay, so as we get a little bit older too, into our 50s, there are some additional concerns when it comes to dryness. And that is really something that for a lot of women can talk about being very painful and really starts to limit their relationship, particularly in a time where A lot of people have older kids, so you've
Empty
got a little bit
nesters.
more freedom and you're kind of reconnecting with your relationship. So what are women experiencing there?
Yeah, you're absolutely right. The golden years are supposed to be golden, and these patients come to me and say, you know, I had no idea that I was going to be experiencing severe pain, pain with intercourse, to the extent that they're not able to be intimate. Mona Lisa Touch is, again, an innovative laser-based treatment that works phenomenally to basically improve the moisture elasticity, as well as work on incontinence issues as well. And what's especially near and dear to my heart is because this is a non-surgical, non-hormonal treatment, it is especially effective for patients who've had cancer.
This is so
It's
important.
really great.
So important, because that is a side effect of after going through your chemotherapy, radiation treatments. A lot of women have no idea that's going to happen to them.
It's awful because these women are, of course, not expecting it. You know, they're expecting to live and have their relationship restored. And commonly, this is not discussed up front,
Yeah.
of course, because that's not what the emphasis is as you're going through the treatments. But ultimately, to find a treatment option that, again, is non-surgical, non-hormonal, that can help to restore the moisture, elasticity, and intimacy back into your relationship. That's what, again, takes us from black and white to color.
Dr. Lisa,
Thank you,
thank you
Dr.
so much.
Lisa.
It's always so fun to have you here.
Really
You see,
informative.
you never have to be embarrassed to
No,
talk about
just
this
girl
stuff.
talk.
We do it right here. Wyzetta Cosmetic Surgery and Spa is offering Twin Cities Live viewers $500 off all Thermiva or Mona Lisa Touch packages through the end of September.
And save the date, Thursday, September 22nd. Join the team at Wyzetta Cosmetic Surgery and Spa for a feminine restoration happy hour. We posted those details at twincitieslive.com. And a big thanks to Wyzetta Cosmetic Surgery and Spa for sponsoring the show.
All right, let's take a look at the weather forecast.